going to go through as a second year Bachelor of Oral Health student is develop the skill of actually being able to come to a periodontal diagnosis. It's a really tricky skill because it takes a lot of thought and a lot of consideration of many different factors for each individual patient that you'll be seeing. So what I'm going to try and do today is just give you a little bit of a thought process that you can go through that might help you develop that skill, and hopefully by the end of the year you will have nailed it. So let's begin. What do we need to make an accurate diagnosis? The first thing is a thorough medical history. You probably covered this in first year, where you looked at different conditions, different medications that may have an effect on the oral cavity. Very closely linked to the medical history is the patient's social history. Now, social history is really important because sometimes people can't cope very well with stresses that they're actually exposed to. So it might be that they might take up smoking, or they might even have to use some illicit drugs like marijuana or alcohol abuse. Once we've got our medical and social history, we then need to consider any aspects of our dental history. Now, this is important in periodontal disease because sometimes there is a genetic link to people that are actually predisposed to periodontal distraction. So it's important to find out a little bit about the patient's dental history, whether they've had a bit of neglect because they haven't visited the dentist or the oral health practitioner often. So there's a lot of information that you can get out of the dental history, including the family history of any tooth loss because of periodontal disease. Now I'm going to bring you over this side of the board. The next step is the collection of our clinical data. So our clinical data is extremely important. There's a few aspects that we need to consider for periodontal diagnosis. The first one is bleeding on probing. It's how much blood is there, how much inflammation is there in the gingival tissues. All right, sometimes it could be profuse, sometimes it could be just mild, sometimes it could be somewhere in between. Apart from bleeding on probing, we also need to consider our pocket depths. Okay, how deep are they? How many are they? Are they localised? Are they generalised? It's very important to know that. Other things we need to consider is recession. Even occlusion sometimes plays a huge role that might exacerbate a particular periodontal condition. The other thing that's really important is the oral health status of the patient with regard to plaque control. Now, plaque control is a really interesting one because it might be that somebody might have lots of plaque deposits and have very little destruction, and yet someone might have minimal plaque deposits but have quite a lot of destruction. And that will determine what type of classification we'll give the patient when we come to the diagnosis. Okay, just to summarise up until now, we look at our medical history, our social history, our dental history. We're collecting all of our clinical data, and then we come to the two most important aspects that will give us that final decision. Age is one of the most important considerations in periodontal disease. Sometimes when we look at the age of a patient, if say we find a 4 to 5 millimetre pocket in a 70-year-old, we're not going to really think that's of much significance because that just could be age changes, physiological changes. But if we were to find a 4 to 5 millimetre pocket in a, say, 17-year-old, then that is quite significant. And that again will determine the type of classification we will give the patient. So never forget to always refer to the age of the patient in relation to the amount of distraction that's there. Now, the other thing that you must never ever forget when you're doing a periodontal diagnosis is radiographs. Crucial. You cannot make an accurate periodontal diagnosis without reference to the patient's radiographs. And most importantly, it's really good to have a radiograph of the current situation and then compare it to, say, radiographs that you might have had for that patient, say about 2 or 3 years before. So you can use a reference point and see how much bone distraction there might have been. Okay, so just to finish off, once you've collected all your data, remember always to refer back to the patient's age and always, absolutely always have your radiographs with you before you can make that final diagnosis. Because any diagnosis that's made without reference to radiographs will be inaccurate. So I hope you can use this now for your future activities in class as well as your clinical experience with your patients.